On Hoth and Swalwyn, Quisplake, which know me to Squal's deceits. I'd like to say I'm really glad that you all came here and joined the webinar tonight. Kayakht, and I welcome you on behalf of the team that's gathered here. I am Sequoia, FNHA is one of their knowledge keepers for the organization, as well as a team elder for many of the teams. And it's a pleasure to be able to open your meeting, which is on a very important topic. And I believe that we need to keep Chen Stwite standing and working together to hold each other up. And tonight is about sharing the presentation with you and having all of you ask the questions back, I believe, and being able to not leave anything a mystery. That way we end up being Nchomo and Squalwyn. And as Shane Point says in Hamalkamalam language, not Sma Squalwyn, which means one heart, being one. And so I think it means being on the same page and understanding everything. And I always say that I like, this isn't for a plug for Nike, but their saying I always liked it was just do it. And in our language, we say wastegate, which means let's go. And so I say that's a Squamish way of saying just do it. So you're all here to wastegate. And I'm going to just quickly do Sequalia's song and do a prayer, then turn you over to the team and let you get on with the work. And it's my hands are up to each and every one of you for all the hard work that you do. It's good to see all the faces that I recognize from the signing ceremony, and to know that we can move forward in a good way for the First Nation, Indigenous, Aboriginal people of BC. I always say that I started out my life as an Indian, then I became a Native, then I was an Aboriginal, now I'm an Indigenous person. And I always say, bottom line though is I'm Skohomish Stoma, I'm a Squamish human being. And that's what we all need to remember, is that every one of us are human beings, and to Winoxus, have respect for each other and take care of each other in the best way we can. So now I'll do greeting of the day. I'm going to ask you to keep your hands open. You don't have to stand today, but keep your hands open and pray for all your family, from the unborn to the oldest. Pray for everyone who has serious illnesses. Right now, I lost an 18-year-old grandnephew to cancer 2 weeks ago. His dad's had an operation for colon cancer today, and 6-year-old Tay is still battling cancer. So others of you know many people like that. And so pray for them. And then I'll say the prayer, and those battling drugs and alcohol, incarcerated, or those who have lost loved ones. Because we always feel it in our heart, and the pain never goes away, but it changes and becomes easier to live with. But there's always that place in the heart that they held. So, and all of you who are listening, please come together with one heart, one mind to pray together for your families and friends and communities. Chen Quemen Tomi Kakakana Chasiam Yonsion So Tunoyop and Munman Disquals Deceits Yonsio Munman Squallowen Snachum Zaitsop Sequadal Chet Disquals Deceits, asking you, Creator, to help watch over and guide each and every one of your children gathered here and help them with their squalwin and with their sequadal Chet, their family and sayayat, their friends, with their squalwin, mental, emotional, physical, spiritual well-being, asking prayers for the words that you're going to hear and take into your hearts and minds and process it and let what you don't need be set aside, and then to speak, see the words, speak the words, or write the words for the Seitzop, the work that you're going to do tonight and into the future. Asking prayers for all of the unborn babies, the Munmun children, parents, grandparents, great-grandparents. Prayers for all of our family and friends who have the many forms of cancer and are getting treatments or surgery. And prayers for those who have heart problems, many different kinds of heart problems, diabetes, HIV/AIDS, tuberculosis, and many other illnesses that there are. And for those who have injuries waiting for surgery or have had surgery, prayers for all of them for their health, healing, and recovery. Asking prayers for all of our family and friends who may be battling drugs and alcohol, especially in this time of opioid crisis. And we're losing a whole generation of people of the same age that are using, and for their families who suffer because of their addictions and fear of losing them, and those incarcerated. We ask that we pray as one heart, one mind for their health, healing, and recovery. Prayers for all our family and friends who have lost loved ones, who feel that pain in their heart, to know that their loved ones have no more pain or life traumas or worrying about everyday life, and that they worry about us. And recently I read the story that said dragonflies have 2 wings because they carry angels on their back. So if you're ever down and feeling sad or just lost in thought and you see a dragonfly, know it's a sign from a loved one who's on the other side, letting you know that they are with you. Or a butterfly, hummingbird, eagle, whatever, they like to let you know there'll be a sign, and you'll know, even if it's walking in a store and you hear a song and it makes you think of a good time with them. That's them lifting you up. So keep all of that memories. They say they live in our hearts and memories. Those are better than any picture that you can take and print, because it's in your heart and mind. So they'll always watch us. Asking you, Kakakonic, to let this meeting go well tonight. Yuan Haltzaitop, excellent work that'll be done. Lots of snachum, lots of words and talking to make sure we come together for the future. Chen Chen Swite, standing and working together to hold each other up and support one another for the well-being of everyone. And asking Kakakonic Chasiam, see everyone home safely tonight, especially with here in this crate. In Vancouver, we're having crazy rain. So for everyone here, I pray that you get there safely. Tamakwetsi Snachum Hoichaka. Tamakwetsi means those are my words, and Hoichaka means thank you.
Thank you.
Chayap, you all take care now.
Thank you. We're just saying, I want to say thank you to Sequoia. Sorry about that. I'm Jocelyn Johnston. I'm the Executive Director for the BC Dental Association. And Sequoia has really brought us to why we're here today. And it's really for improving rural health in First Nations.
And I want to thank the First Nations Health Authority and Pacific Blue Cross for all the hard work that they've done in pulling this together. I think in dental offices on the 16th, you're going to see a significant change, and I think it's an important change and a change for the better. I'm not going to spend a lot of time on this, only to say that this is the first province here in BC that we are seeing First Nations taking over the management of their health benefits and their health care. So I think we want, as the dental profession and the people who support, to really invest ourselves into this whole process so it's successful. So I'm going to start now by just introductions, and then I'm going to turn it over to the people who know everything. So the first is Darren McKnight. He's the Director of Benefit Management at FNHA. We have Connie Chung, Manager of Provider Relations at FNHA. Connie DeRosa, Dental Team Lead from FNHA, and Deborah Bagri, a former BC Dental Association employee, is a dental assessor with FNHA. From Pacific Blue Cross, we have Carlos Sorensen, Manager of Claims Services, Laura Dale, who's the Manager of Claims Policy and Standards, Wendy Watkins, Senior Manager of Operational Solutions, and I have my staff here, Tanya and Kushbu, will be helping out with the questions. So thank you, everyone, and I'm going to turn it over now to Tanya, because she's going to provide you with some information on how you can ask questions.
Hi, everybody. So I'll be managing the questions and the technology. On your Zoom webinar facing, if you hover down at the bottom of your screen where your video is, the toolbar that you can also see on the presentation will show up. We're going to take questions in two formats today. You'll be able to type your question into the chat box at any point throughout the session. And this can be questions related to the presentation, or if you're having trouble hearing, or you can't see something, or any technical issues, you can also type those in there and I'll answer those for you. And in addition, we're gonna do some questions and answers over if you wanna speak your question out. The process for that is you will click on the raise your hand button that's down there at the bottom, and it'll turn green when you click on it. And then once it's green, that means that I know that you would like to speak out loud. And then I will go through the people who actually want to speak out loud, and I'll introduce you, and then you'll be able to be unmuted and ask your question. So that's kind of the process. The easiest is probably just to do it through the chat, but we do welcome if you do actually want to speak out loud. And then we'll have people in the room who will answer your questions.
Hi, everyone. It's Darren McKnight from the First Nations Health Authority. Before I get started, I do want to thank you all for taking your evening to join us, and also to the BCDA for hosting. In terms of our outline for today, myself, as well as Connie Chung, will talk about the health benefits transformation journey. And then we'll, as Jocelyn said, we'll turn it over to the experts to discuss our new plan for clients of the FNHA, talk about identifying clients and processing claims, as well as some other resources. And as mentioned, we will move into an open question period towards the end of the evening. Just briefly to provide some background in terms of health benefits transformation. Benefits transformation, for those of us at FNHA, it really has been the focus for our organization since it was created in 2013. At that time, we took over programs and services that were previously handled by Health Canada's First Nations Inuit Health Branch. Our vision at FNHA is to transform health and well-being of First Nations people in BC by dramatically changing healthcare for the better. In working towards this vision, we've really been fortunate to have our federal partners, specifically the Non-Insured Health Benefits Program, or NIHB, which you may be familiar with, provide us and our clients with continued access to their platform while we've put in place new systems and partnerships that will help us address the unique needs of First Nations people in BC. We've approached transformation in health benefits in 2 phases. Our first phase included work with the province of BC and BC Pharmacare and led to the launch of what we call Plan W, which is a fully paid first payer drug plan that's available to all First Nations people, all eligible First Nations people in BC. That launched in October of 2017. Following that, we moved into this phase, our second phase, where we turned our attention to transforming the benefit areas of dental, which we'll speak about tonight, as well as our vision and medical supply benefits. These are areas that have been managed either partly internally or through our NIHB partners really since 2013. To go through the steps that we've taken, just in general, we conducted an RFP in 2018, and that led to the selection of our partner in Pacific Blue Cross to help work with us on transforming the dental benefit. Over the last 12 months, our teams have been putting significant energy into going out and engaging with our stakeholders, both clients and providers, to learn about their thoughts on our program and where they felt we could do better. We really have taken this feedback into consideration in redesigning not just our dental plan, but also our medical supply and vision benefits. In April of 2019, FNHA and PVC formally announced our partnership. That event, as you can see on the screen there, was a formal signing ceremony, which I think importantly, it included the signing of not just a 5-year services agreement, but also a declaration of commitment to cultural safety and humility in health services, which it is an important piece of work for the First Nations Health Authority as we move forward. So that really then brings us to today. At this point, we're 7 days from the go live of our redesign of both our benefit plans as well as our service model. We're very excited to be here with Pacific Blue Cross, with our BCBA hosts, and of course with Sequoia to share more details on this work.
Hi everyone, this is Connie. So we're starting to see good changes to the healthcare system as the climate for change is growing. Cultural safety is being hardwired into the healthcare system through actions like declarations for cultural safety and humility with partners like Pacific Blue Cross. So cultural safety is about understanding that you don't know how the person you're interacting with feels, and you have no idea what can trigger others. In working towards reconciliation, decolonizing the healthcare system, and changing the system where people will feel safe when receiving health services is an ongoing process. Your role is a reflection of your reactions and the learning that comes from your own cultural humility journey. So for the past year, we've listened with big ears to learn about what works, what doesn't work when it comes to dental benefits, and to gather ideas on how to transform care. Our team has traveled to First Nations communities across BC and conducted focus groups with community members and got feedback from health leads working in communities. We also interviewed dental providers from all different oral health professions, including the professional associations, dental offices, and providers that work closely with First Nations. So one of the really interesting things, even though we've interviewed a whole range of communities and health providers, the striking message across the board was that we needed to improve our administrative and adjudication processes, that dental benefit coverage for BC First Nations was substandard, and that unsafe healthcare interactions continue to be a barrier for our clients. This quote was one from our community focus group sessions that really speaks to the importance of why we're transforming benefits and the great need to remove systematic barriers to support First Nations health and wellness and to support First Nations to be self-determining. Over the course of the past few months, it has been really inspiring to see hope from both our clients and providers for improvements to dental benefits for First Nations.
Hello everyone, Laura Dale from Pacific Blue Cross. I have the privilege of introducing some of the high-level overviews for the dental plan that will be launching on September 16th, 2019, which I can't believe is next week. So one of the things that I want to draw attention to is the fact that we've published additional materials to be able to support you in understanding the dental plan. So we've called this the First Nations Health Authority Fee Supplement. You can appreciate that Pacific Blue Cross also publishes a dental fee schedule. So I want to clearly, before we continue in the presentation, distinguish that these are two separate documents intended to be read in tandem. So the fee supplement for First Nations Health Authority contains products and services or rules that are different than or are in addition to the Pacific Blue Cross dental, denturist, and or hygienist fee schedules. So Pacific Blue Cross, as you have heard, is going to be administering FNHA dental plans on their behalf. And we want to call out that in general, FNHA is following the Pacific Blue Cross Dental Fee Schedule 3. When you go to pacificbluecross.ca, we wanted to abide by some of the transparency policies that we've heard when we were in community about making sure that you had access to the dental plan in its entirety. And so what we've done is we've overhauled our website and we've made it provider specific. So if you navigate to the dental section of the website, you will find this fee supplement, which I highly recommend you download, possibly look at during this webinar so you can follow along with us. This fee supplement is primarily broken into kind of tables with regards to preventative and major services. There are headers in the fee supplement, which calls out the major category, the fee code, the description, the FNHA specific rule, or the specific price or alternative fee code. So what we want to draw attention to here is that if the price is printed in the FNHA specific fee supplement, it is an FNHA specific price. If the PBC fee code is printed in the specific price or alternative fee code column, please refer to the Pacific Blue Cross fee schedule. Furthermore, if that same column is blank, we will be following the BCDA's General Practitioner Fee Guide, and those prices will be allowed. So what we're going to do now is we're going to provide a high-level overview of some of the significant changes that you will likely experience as a result of administering this dental plan. We are absolutely thrilled by some of the high-level overviews, and I'm looking forward to all of the questions that you'll likely have at the end concerning the dental plan. So for diagnostic services, these are exams including new patients, recalls, and specific exams. We're looking at 2 per calendar year. To draw attention to some of the scaling and preventative services, including root planing, there are additional dollar limits combined to a dollar maximum of $591.50 per calendar year. We did hear a lot of commentary in the dental community regarding polishing and fluoride. This was brought up in every single interview that we had with the dental community. The new plan will pay $37.35 per polishing, 2 times per calendar year. For fluoride, we will be also having 2 treatments per calendar year, and there will be no age restrictions. I've heard from community as well that night guards are a very important topic, especially to maintain the quality of all of the amazing work that you've done in the mouths of these clients. And so we will be having night guards limited to 2 appliances in a 5-year calendar period. For restorative services, for fillings, dollar equivalents of 5 surfaces per filling per tooth in a 2-year calendar period is also going to be covered. Highlighting here that this is going to be including tooth colored restorations. This, for everybody's awareness, is going to be for all teeth. For root canal therapy, this is not actually going to be requiring the predetermination. can hear you all cheering over here. Moving forward, I would like to draw attention to the fact that extractions will also not require predeterminations. I'm going to pause here for a second on bridges and crowns. So Pacific Blue Cross, I'm sure you're familiar with, has a lot of benefit management strategies with regards to making sure that our dental plans remain sustainable. For the First Nations Health Authority plan, all of our consultant review protocol will remain intact. In addition to this, for bridges and crowns, certain inlays and onlays and veneers, claims under $4,500 in a 5-year period will be subject to standard consulting review criteria as indicated previously. Claims over this dollar threshold will require a consultant review. Moving forward, sedation will be following a very similar process to the NIHB plan. However, we have reduced some of the predetermination requirements for minimal sedation and for moderate and deep sedation. Of note to the practitioners in the webinar who will be providing dentures, there will be denture coverage limited to 1 upper and 1 lower denture in a 5-year period. Of note, the rebases, relines, removals, and repairs for the dentures will be updated to the PVC fee schedule. Furthermore, for orthodontics, up to $7,500 per lifetime will be eligible, and we will be following the same criteria, which was the HLD index, hoping to improve the administration processes so that you will understand the claiming eligibility quicker. For Pacific Blue Cross and for FNHA, we will be paying lab fees at 100%. Furthermore, if you are a specialist, we will be paying an additional 10% of the eligible general practitioner fee. I know that was a quick little blush through with the dental plan, so I am going to draw attention to where you can find this material again with the visualization. Since Pacific Blue Cross is the third-party administrator, you will not have to register again if you are already a registered provider billing to Pacific Blue Cross. If you are not registered with Pacific Blue Cross, please navigate to pac.bluecross.ca and follow all of the prompts under the new provider category for dental. With ProviderNet, we highly recommend that you register for direct deposit. You will get paid much quicker than had we been sending you checks. You can look up eligibility as well, which is a functionality that we think you would absolutely benefit from for the transition for the First Nations Health Authority. Furthermore, this is an opportunity for you to check predeterminations when applicable on our online portal. To ensure that the identification of First Nations clients is smooth, Pacific Blue Cross and FNHA have indicated a group ID, which is 40,000. For FNHA clients, for their identification, it will be their status number. First Nations clients have the ability to log into our portal and download a Pacific Blue Cross style card with their policy number and identification. However, most commonly, the status card will be used as the identification for these clients. When you have a new client in front of you, please accept either 1 primary identification or 2 secondary identifications to ensure that you're validating the status number. Like we mentioned previously, you can view the client's coverage on ProviderNet by querying the policy and ID. However, we understand that some circumstances may happen where there is no status number, or it could be an incorrect status number. Processes should remain the same, which will be to email FNHA health benefits. Following very similar standard protocol with regards to client eligibility under the NIHB plan, the clients, in order to be considered eligible, must have a status card or be an infant up to the age of 18 months old of an eligible parent. They must be residents of British Columbia according to MSP and not be funded or insured under any other benefit systems, including federal or self-governed plans. Furthermore, the following First Nation individuals are not eligible, which could be those who are not resident in BC, incarcerated in a provincially or territorially funded institution, or children in provincial territory funded care. Given this was a high-level overview of client eligibility, please download the latest version of the Pacific Blue Cross Dental Reference Guide, where this is outlined in greater detail.
Hi everyone, it's Carlos Sorensen here with Pacific Blue Cross. So we're just going to look at the overall process for claim submission, which generally speaking is going to remain business as usual for the majority of claims. So please proceed and continue to submit claims on behalf of your FNHA clients, whether it's through EDI or paper submissions. Bill the fee items that you're performing as well. And when it comes to the lab fees, please make sure that lab fees are actually not separated on the manual claims, that they are itemized with the professional fee and that they're put as a total beside the professional fee on your claim forms. When you're submitting electronically, please do separate the lab fees so that they're put in as a different line item. When it comes to patient signatures, these are required on all of the claim forms. And of course, if you're submitting electronically, please make sure that you have the patient's signature on file. When it comes to adjustments or resubmissions, after you've already received an adjudication result from an initial submission, the patient signatures are no longer required on those. And provider signature are required on original claims as well. When it comes to coordination of benefits, FNHA's plan is the payer of last resort. The only exception to this situation would be accounts where individuals have purchased top-off plans. And so if you submit to a particular carrier where they have only top-off coverage and you get a $0 amount paid, please go ahead and submit those explanation or those statements to Pacific Blue Cross. We will make sure that we pay FNHA in those cases as a primary payer. And then, of course, health savings accounts are also the other exception, which would be the very last in the sequence of coordination of benefits there. It's really important that if a client is eligible for another public-private healthcare plan, that you submit to those carriers first, and again, submit their statements to us. Of course, if you're doing this electronically, you'll be able to submit one submission that'll pay the other carrier that they have coverage with, and then it'll pay to Pacific Blue Cross after as a secondary plan. When a client is no longer eligible for coverage from another payer, please, whether it's yourself or if you're speaking with the client and the client would like to do it for themselves, if one of you can please contact PBC. That way we can update the coordination of benefits file to make sure that we're not asking for a previous paid amount when it's no longer eligible. As mentioned previously, we have an FNHA dental fee supplement, which will be available to download on our website. We also have a link here in the presentation where you can get the fee supplement. This contains product service rules that are different or in addition to the PBC dental fee schedule, or the denturist fee schedule, or the hygienist fee schedule as well. As previously mentioned, these fee schedules and supplements are meant to work hand in hand in tandem. So please make sure that you familiarize yourself with the new edition in the FNHA fee supplement. The fee supplement contains requirements for any rules, criteria, limits, and or additional documentation that may be required for FNHA specific service codes and procedures. When it comes to orthodontic treatment, the FNHA orthodontic criteria and guidelines are also available on our website under the dental provider section. We have a link as well included in this presentation. This guidelines and criteria contains the orthodontic submission review process and the documentation requirements, including the claim forms that you need to send in with these submissions, as well as supporting documentation like photographs, x-rays, and study models. When you're submitting your claims, please make sure that you submit your receipts and or claim forms manually when it comes to orthodontic services. You can submit, once the treatment plan has been approved, you can submit claims on CaresNet, so the clients can also go on CaresNet and include submissions for their initial and monthly fees. Again, this is only after the treatment plan has been approved. Predeterminations. Predeterminations are a great way to understand the coverage that is going to be eligible for your clients before you go ahead and perform the services. It's also a way to understand if certain claiming criteria is required, that you have that type of documentation ready to submit to get the reimbursement under the eligibility of the plan. Outstanding predeterminations with NIHB. If you're submitting using NIHB predetermination number for reimbursement to be paid, please go ahead and do that. We will process the claims at the new PVC fee schedule and FNHA fee supplement service code pricing. You can submit your pre-authorizations or your predeterminations by mail or fax. And please note that if you submit a predetermination without all of the complete documentation, we will respond back. We will send the pre-authorization or the predetermination back to you, itemizing the things that were missing. But it's really important that you resubmit all of the documentation with the new submission. We will not be piecing different pieces of supporting documentation from submission 1 with submission 2 to get the whole picture, for example. If you submit to us manually by paper, we will mail back the predeterminations that way by mail. Otherwise, if you're set up on ProviderNet and you have an account and you're set up with EFT, you will get your pre-authorization or predetermination results back electronically on through email, and all of them are reviewable as well when you log into a client's account under their authorized products and services history. Please make sure that you see the FNHA supplement to see if there's claiming criteria requiring a predetermination. We will be loading 2 years of client history from NIHB. So any decisions that have already been authorized, we will also be honoring as they will come over onto our software. You can submit manual paper claims through using the Pacific Blue Cross Dental claim form found on our website, or you can continue using the CDA standard form. We know we see a lot of those still coming from the majority of the offices, so those are still more than welcome submissions. And then, of course, make sure that when there's predeterminations involved, that you're submitting the supporting documentation as outlined in the fee supplement. Continuing on with the predeterminations process, orthodontic treatment plans need to follow the criteria and the process outlined in the guidelines and criteria, and also in the claim form that we have for FNHA orthodontic treatment plans. Both of these are available on our website under additional resources under the dental provider section. Please make sure that you enclose copies of all supporting documentation. And just adding on a note that something that I spoke about just a minute ago, it's just really, really important that if submissions are sent back for requiring additional documentation to be resubmitted, that it's really important that we get the full and complete submission on the resubmission. If you're submitting digital copies of photographs or x-rays, those are going to be something that we are going to securely recycle at Pacific Blue Cross. We will not send those back to you. We will only send back original documentation such as study models or original x-rays. So when you send back the resubmission, it's really important that you put back in the photographs, that you put back in any digital x-rays that you submitted on the original one, so that we have one complete package that our consultant can sit down and look at the entire treatment plan and make a decision based on the complete documentation. For appeals and escalations, once you've received the adjudication result, if you feel that there are extenuating circumstances or reasons why you feel that we should have a second look at the claim submission, please go ahead and submit those appeals to our benefit review committee. The mailing address is on this slide of the presentation, and we will look at those appeals to make sure that that we're reviewing every opportunity, reviewing any opportunity for circumstances where maybe things require a second view by PBC.
So in case you're not tired of us talking about how you can go to pacificbluecross.ca for all of the resources, here's another slide that will tell you where to get all of the latest and greatest. I would recommend that you do not print a copy of the fee supplement and keep it on your desk. Use an electronic copy whenever possible, as of course this is a plan where minor modifications may be made, and we would like to make sure that you always have the most accurate information that is up to date.
The FNHA website is a great resource for cultural safety and humility materials. We also have the First Nations perspective on wellness on our site, as well as a really great video featuring Connie Pauls that talks about First Nations history with dental providers. If you haven't heard already, there's also an Indigenous cultural safety course that's offered by Sanyas through PHSA. Or there's a free resource through the BC Patient Safety and Quality Council that features a webinar series.
Hi everyone, it's Darren again. Just to conclude here, I hope it's come across that certainly everyone at FNHA and I think that partners at PBC, we're excited that our new dental plan will be effective in 7 days on September 16th. For any provider inquiries, certainly you can contact PBC at 1-877-PAC-BLUE. As Carlos mentioned, outstanding PDs that haven't been claimed will be paid at the FNHA fee supplement or PBC fee schedule rate. You can go online, as Laura mentioned many times, to find the latest information on provider registration, claiming our fee supplements, as well as the PBC fee schedule. And just a reminder, this webinar will be posted, if you've been recording, it will be posted online for future reference. So I think that takes us to the end of our program, and here we will open it up to questions. I understand that a number have been coming in through the chat functionality while we've been talking. That's great. That'll help us get started, and then I believe we'll open it up after that.
Hi everyone, I have a few questions that I've outlined here that I can get us started while my colleagues start answering the other questions. The first question that came in was, does this change make any differences for dental offices who are in Alberta? So yes, this will change only if you have an FNHA client in your office. This will not change anything if you have an NAHB client. The next question I have here is, what about 8s for endo? So these will be considered on the same basis as the fee codes for endos 1 through 7. This is the same as PBC standard. However, we would like to make sure that you check the fee supplement as well. I would like to clarify that that's for teeth 1 through 7. The next question I have is, could you please clarify how to get an authorization for crowns with PBC? Is it the same as now for PBC patients, where we can EDI for crowns exceptions? Well, the exceptions are 3 through 3s. And it's, yes, this will be PBC standard. So question 4, is the window for sending claims, EDI, 2 months now, or is it still 30 days? I believe CDA removed the 7-day limitation a few years ago, and so PBC does accept claims that are a year old. However, just send them right away.
Yes.
Do it quick. So question 5, are there still only 2 endos available per calendar year, or has the limit been removed? And so this is 1 per tooth per lifetime. Question 6, are these new or different codes than those in the provincial? So the only ones that are not in the provincial plan are the 897707 and 8/9, which is the orthognathic surgery. All others should be from the provincial, aside from 1 or 2 codes that are for the orthodontic codes, which exist in the PBC fee schedule. Question 7 was, could you please confirm who is primary when there is FNHA and ministry coordination of benefits? So ministry will be primary to FNHA. So question number 8 was, do we still use the DENT 29 for PDs? So our philosophy is that we use PBC forms whenever possible and FNHA's forms. And obviously the CDA form.
And then we also have a question on where Jordan's principles come into play with the new system. There's no changes with Jordan's principle.
So I have another question here, which is, I am an independent dental hygiene provider. Hi. I use the CDHA dental claim form for other PBC group numbers. Is that acceptable for group 40,000 as well? Yes, it is absolutely acceptable. You guys ask good questions, my goodness.
So another question came in, how do we retract claims? And that would be the same as today. So if you're doing an EDI claim, you can just reverse the claim. If you submitted a claim manually and you figured out that it was the wrong individual that you sent the claim in for, and you want to reverse, you can send a reversal claim form as you would today with the comments on the claim form itself. Another question here regarding ministry coverage and coordination of benefits. Will PBC coordinate ministry plans with FNHA plans? These, as long as the information on the claim form shows that the coverage is for both of both ministry plan and the FNHA plan, then yes, we will provide coverage and process the claim under both the plans. Again, FNHA being the secondary payer after ministry. Question regarding orthodontic. Can an ortho only be by ortho specialists, or can general dentists who have ortho be eligible? And that is also business as usual as it is today. We have lots of general dentists or GPs who submit orthodontic services and treatment plans today. So that will be the same going forward. Whether you're a GP or an ortho specialist, you can submit for orthodontic treatment plans.
Okay, I have a question here as well, which is, will you pay for root canals and crowns on 7s? answer is yes. I have a question for Connie and Darren here. So to be clear, NIHB and FNHA are different.
Certainly.
Very clear.
Yeah, so the NIHB coverage will continue for First Nations people across Canada outside of BC. We provide coverage for all First Nations people that are residents of the province, with a few small exceptions, like groups like the Nisga'a in northern BC, but largely for the 150 or so thousand First Nations people in the province, FNHA would become or has provided and will continue to provide benefits for those clients.
So another question here is, if we have an issue with a claim before September 16th, what do we do? So until September 16th, you should be dealing with NIHB. However, after September 16th, regardless of the dates of service, you will be dealing with Pacific Blue Cross.
Okay, so a question here regarding signatures. Do we need original signature on claim forms, or can we write signature on file? When it comes to paper submissions, we require the original signature on the actual claim form. Signature on file will work for EDI submissions, but for the claim paper forms, we require the original. Another question here regarding NIHB. How do we know if they are FNHA or NIHB? One of the ways that you could do so would be by getting the status card and logging into ProviderNet. If you put in the policy 40,000 and you put in their status card number and they come up with coverage, you know that they're FNHA. Another way would be to call our call center. You could ask, provide again the same information, the status card number, and one of our CSRs could look up the coverage for you over the phone. I think those would be probably the best two ways that you can confirm coverage if you're in doubt. Another question here regarding orthodontics. Do you still require orthodontic style models for predeterminations? I'm not sure what orthodontic style models exactly are. We're looking for study models and or pictures of the study models that show the criteria in the guidelines as being met. So I would say the answer is yes.
Yeah, it's Wendy of Pacific Blue Cross. We're going to be administering the same ortho criteria that NIHB did. So yes, please continue to send the same type of supporting documentation that you do today.
Okay. There is a question. I have approval for treatment under one provider and I'm now needing to amend provider or code. Is the process the same?
The predetermination, if the treatment is exactly the same, the predetermination is actually for the client, not necessarily the provider. But if a code changes, of course, that would have to be resubmitted and amended. The same way you do with Pacific Blue Cross today.
And with coordination of benefits, if the service took place before September 16th, they're doing the claim with PBC or ESI, if it was before September 16th.
If they're submitting the claim after September 16th or after next Monday, they can submit the claim to Pacific Blue Cross.
Everything will be with Pacific Blue Cross after September 16th, regardless of the date of service.
Okay. Are claims still covered for fillings done by different provider within the same year?
Sorry, can you repeat?
That's good. Are claims still covered for fillings done by different provider within the same year?
As long as they're included up, basically we'll provide coverage up to the 5 surface filling. So whether it's one dentist that does 2 and another dentist that does 3 in a 2-year period, it's not so much that how many dentists are doing it, it's more that we will only cover up to the 5 surface filling equivalent.
If I can add, the FNHA plan allows for coverage of fillings that have fallen out. And if you have a look in the introduction to the supplement, you'll see some information about that.
I have a question here regarding orthodontics. I work in an orthodontist office. We have claim forms signed for all P1200, P1300, P1400 on Dent 29 forms. Do these need to be redone on PBC claim forms and redesigned and re-signed by patient on the claim form? If you already have the signatures and you already have the paperwork ready, submit those to Pacific Blue Cross and we'll handle them. We're going to honor the NIHB forms that have already been completed and filled. So no, you do not need to get new forms and have them re-signed.
So I have a question here, which is, will missing teeth still be required for predetermination? And this is same as Pacific Blue Cross, so that's no. Now, the next question is, do oral surgery practices need pre-Ds for sedation? And oral surgeons do not.
But if you're limiting your practice to oral surgery, then you would have, and you're a general practitioner, you would have to get approval.
Please see the dental fee supplement for more details. So question regarding predeterminations and electronic submissions. Can predeterminations be sent EDI with an immediate response? And the answer is yes. In some cases, predeterminations can go through and they will provide, they could provide an approval in real time. However, if there is a situation where we require supporting documentation, then the immediate response is actually going to be that you need to submit it on paper so that we can get the x-rays, photographs, study models, or whatever else is required, clinical description. Unfortunately, we don't have the CDA net version yet that allows us to receive electronic submissions with supporting documentation. And as a result, any kind of claim or service code that requires that would have to come in manually. But please go ahead and try. If it goes through, then you're good to go, and hope you have a great day.
So there was a question, parenteral, I think I'm saying that correctly, parenteral conscious sedation was always paid with FNHA. In the PBC guide, it notes eligible only in conjunction with oral and periodontist surgery. We do full mouth restorations under sedation for children from 2 to 12 years. Perianthal.
Right. I feel like that's in the fee supplement, but I'm going to have to look it up.
Okay, that one we'll have to come back to. Like that'll be a separate.
Thank you. We have another question. Says, I'm looking into the prosthos section of the fee guide, and the fee codes are in the 50,000. This would be in line with the CDS BC fee codes. What about Denturis fee codes? So yeah, Pacific Blue Cross follows the CDA Universal System of Listing, sorry, USCLS coding for the dentists, and we follow the Denturist Association of Canada fee codes for Denturis. And similarly for hygienists. I won't belabor the acronym, but we're using the national code set.
Someone asking, will partial dentures still require pictures of models on file as currently for the partial denture trial project?
Can you repeat
Oh,
the
yeah,
denture
I can
question?
Will partial dentures still require pictures of the models on file as currently for the partial denture trial project?
For partial denture coverage with Pacific Blue Cross, it's the same as it is today. So whatever is normally required by the college and your association for your general acceptable practices, there's no additional requirements from Pacific Blue Cross.
Can we go back to that question regarding sedation?
Yes.
So under the dental fees, under the FNHA fee supplement, there is a section regarding anesthesia, and I believe it refers to table 1 in a lot of the different service codes. So there's minimal sedation where you do not require predetermination for that. So yeah, minimal sedation, and the fee codes are 92411 to 92419, 92431 to 92439, and then 92421. So all of these codes are eligible and they do not require predetermination. If you're looking at doing moderate sedation, then you're not an oral surgeon, then yes, you would require predetermination. And one of the criteria that we list specifically under, or one of the things that we're looking at in the criteria here is if patients are medically or physically compromised. So I think if you're with the question regarding working on younger children and doing, I think it was it fillings or full mouth restorations. I think a clinical description to support the reason why you're providing that kind of, why you require that kind of sedation would meet criteria. We need to get that information on the submissions.
And if I could, it's Wendy, I'd like to point out, maybe take this opportunity to point out the fee supplement is kind of like an override to the fee schedule. So while you'll find the the anesthesia codes in both the PBC fee schedule and the fee supplement, in this case, the fee supplement is the record of truth and the fee schedule rules do not apply in that case.
All right. What happens when our clients who are at high risk for recurrent caries cannot have their teeth fixed for 2 years? So they already have clients with recurrent caries unable to have their teeth fixed again within the 1 year limit. Therefore, they have to wait and the decay progresses.
Yeah, for restorations, we do have the restoration limit of the maximum 5 surface dollar equivalent in a 2 year period. I would say that if there was exceptional needs, you'd want to submit that in writing to Pacific Blue Cross.
Okay.
That'd have to be an appeal. Yeah.
So I have a question here, which is there still a 3-month wait period before a crown will be pre-approved on a recently root canaled tooth? And the answer is no. So the next question I have here is, if we send a manual claim to the ministry with emergency coverage, can we also attach the PBC form for the FNHA coverage so benefits are coordinated quicker? Absolutely. Anything that you can do to support a quicker coordination of benefits is great for us.
There was someone who's asking, do all dentists accept PBC? In their region, many dentists don't accept clients with NIHB, and out of the 55 dentists or so, only 6 to 7 accept NIHB clients without having to pay up front. And they're wondering, will this shift those numbers?
Yeah, absolutely. This is Laura here. I'm responsible for provider relations, and our dental saturation ratios are impeccable.
Yeah, and then it's Darren from FNHA, and I think you hit the nail on the head as to one of the reasons why we're excited about this partnership, right? We really think that this is one step in removing barriers to access to dental care for our clients. So it's one of the reasons we're excited about next week.
So I have a question here, which is there any limits to nitrous, minimal sedation, and any age restrictions? Yep, there's 4 visits with 4 units per visit per calendar year. Yeah, and this is for all ages. So I have another question here, which is NIHB used to only allow 2 endos in the mouth per calendar year. Has that limit been removed? So it's 1 per lifetime per tooth. So the next question I have here is, what will be the criteria for RPD now? Like any particular number of teeth needing to be missing? And the answer is no, this will be PVC standard.
All right, there was another question. The current FNHA coverage covers crown and bridge 3 months post-endo and a new x-ray. Is this policy still valid? And will crowns were only covered in the restoration was more than 4 continuous surfaces? Is this also still the rule? That one.
No, it's not the rule anymore.
Okay. Who signs the claim form if the patient is a child?
Yep, that would be the same as PVC standard, which would be the guardian.
So the question here is just to clarify, a BC resident would fall under FNHA, not NHIB. Yes, as long as they're eligible under our client criteria, a BC resident would likely fall under FNHA.
I just want to add to that. I think once again, if you have a doubt, give us a call or log on to ProviderNet and take a look and see if they are already enrolled under coverage for FNHA, and you'll know and you'll have a confirmation of that. So the second question here is regarding coverage, crown coverage. What are the limits for crown coverage? How many per year? So crowns are eligible once per tooth every 5 years. It's a PVC standard rule. Yeah. So once, yeah, one. And then just to reiterate what was what came out in the presentation, that on top of our regular consultant review process, where we may ask for supporting documentation for certain crowns, once you've received $4,500 worth of major services within a 5-year period, any crowns or bridges will require supporting documentation on every predetermination or submission. So, but again, the limit is 1 per tooth per 5 years. Next question, is there still a 6-month leave time between endo and crowns? No.
So I'll ask a question. The 4,500 review, so if it's under 4,500, it may be subject to questions or verification. Over 4,500 automatic. So what is the review? Just a request for additional x-rays and documentation. And that'll automatically happen when the patient hits over 4,500.
That's right. So exactly, once a patient hits the 4,500 on major crowns and bridges, if you submitted an EDI claim or a predetermination, it's going to reject, saying please submit on paper. And it's just so that our consultant can review x-rays, photographs, clinical, to make sure that the crown or the bridge meets the criteria as set out in the fee schedule.
So it's good to keep track then to have a patient, you get the crown and then a bridge, and you're getting to that 4,500 to be ready.
Yes, and it's why we wanted to make sure that that rule was in the fee supplement, that everybody was aware of it, that it was very transparent about what would happen after that dollar threshold for the 5-year period.
So we have a question here, which is, will EDI claims be rejected if the signature is not on file? This is kind of our same standard practice. We expect you to keep these signatures on file, and they are subject to audit, and we trust as reputable professionals that you will do such. So the next question is, will the new scaling limit backdate to the start of 2019? Good question. And yes, this is a calendar year limit.
The other thing I'd like to add is we are loading into the Pacific Blue Cross system 2 years of claim history, so that information will be on file.
We did have a question. Will group 40,000, coverage reimburse the client directly if a practice is non-assignment, or will they pay only the provider like the ministry coverage?
We will reimburse clients as well. So we will, like our standard book of business or PBC standard, if the claim form is asking for payment to be sent to the client, then we will pay the client. If it's asking for payment to go to the provider, then we will do that as well. FNHA clients will also have access to member e-claims, to our e-claims portal. So for example, I know for the dental side, it's only limited to the ongoing orthodontic fees, but if they had orthodontic coverage that was approved, a client could go online and also submit their e-claims for that type of service.
Someone asking, do we need a pre-authorization for oral sedation or general anesthetic if we are a pediatric specialty practice?
Yes, you do. Only an oral surgeon is exempt of requiring predetermination.
So there's a question of, if we treat an out-of-province status patient, do we still submit the claim to ESI and NIHB? And yes, this will probably impact you if you're a border provider and you see a lot of patients from Alberta. Next question, is porcelain fused to gold still the only tooth-colored option allowed for crowns? So all fee codes are available in the PBC dental fee supplement.
If a new patient comes to your office and wants new dentures, but PBC only has 2 years of history on file, how will you know if it's been more than 5 years since their last new dentures?
Well, we won't have record of the denture on file, but the claim forms standardly ask how old the existing denture is. But honestly, if there is no claim history there, it will be covered, but then that will reset their 5-year limit.
Someone asking, can we fax to PBC when sending for final payment if we attach a copy of the primary payment?
Yes, you can. Please and thank you.
Right. Do we still need to have a PA of a tooth that has had root canal treatment 3 months post to get approval for a crown on that tooth?
This is just so yeah, Pacific Blue Cross doesn't have the 3-month rule, so with the root canal and crowns. So it's just our standard Pacific Blue Cross criteria for when crowns need to be reviewed. We want to see x-rays and clinicals and supporting documentation that way, so it doesn't mimic NIHB.
We are a not-for-profit clinic and we submit treatment under a single unique number for all our dentists. Will we be able to continue to do this for FNHA patients?
Yes. And yeah, and hopefully you have the unique number that's on the CDNet pilot so that you're able to submit electronically. So yes, please continue to do so, and thank you very much for all you're doing in the community.
Oh, I have someone who's having trouble downloading the fee supplement. Maybe you can send your email on one of the questions and we can always send it to you if you're having any difficulties.
And we will be releasing the PowerPoint as well as some of these links in a follow-up email, I believe. So you will also be able to access it from there.
We have a couple of questions, sorry, and I don't recall the numbers off the top of my head, and I'll need the fee codes to be able to answer the question. So the silver diamide fluoride, I don't have the BCDA guide up, so thank you. And the nitrous oxide, I can't remember what the fee code is. The question is whether those two items will be covered, so we'll look those up.
Along with that, someone's also asking about CEREC crowns being covered. CEREC crowns
Sarah?
being covered? Yes.
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 CEREC, yeah.
The question about the partial denture trial project for BC residents, it will no longer mean anything. That's dentures.
Thank you.
Whoever had asked that.
Okay. Will payments be separate between FNHA and other patients with alternate PBC coverage? So if they're FNHA as well as.
Sorry, I missed the beginning of the question.
Will payments be separate between FNHA and other patients with alternate PBC coverage?
Payments, no. It'll all be on one combined statement. Sorry, I've heard the term silver diamond, but I'm not sure which fee code it is.
13601.
Oh, thank you. Thank you, Carlos.
No, I think it's.
It's not.
I'll double check.
So the question was, will silver diamine fluoride be covered? And the answer is no.
It's not.
Oh, so the question is, do we need to set up fee schedule 3 for FNHA? The answer is yes, but you probably already have it in your software as well. So just make sure that you're pointing your clients to Pacific Blue Cross. Yeah, especially the fee stuff that your software vendors would have coded into the system.
Sorry, if I can add to that. So for the FNHA members, they'll have Schedule 3 in the Pacific Blue Cross fee schedule, except where it's different in the fee supplement. So there's some additional services that are covered in the fee supplement that aren't outlined in the Pacific Blue Cross fee schedule that you'll want to also be aware of. The question was about whether nitrous oxide would be covered. If you're referring to the 92431 series, the answer is yes. It's under, I think it was the moderate sedation. Minimal, thank you.
No,
You guys can answer this.
no people required.
Thank you.
I'll ask another question. If we were looking to get a code covered like silver diamond, because Healthy Kids covers it, what would the process be to get that code covered?
Well, it's a decision that now would FNHA would be capable of making. So we would consult with our partner, talk about the pros and cons of coverage and cost implications, and make a decision from that.
The question is, will the pulpectomy be deducted once the complete endo is completed? And the answer is yes.
It's as per the Pacific Blue Cross fee schedule, it's included in the cost of the root canal. But we don't know that you're going to do the root canal, therefore we pay the pulpectomy until such time as you bill the root canal. And then the last question is I think it's a bit of a repeat, but is nitrous oxide eligible with all restorations or just surgeries? And the answer is restorative or surgery.
And then building off of that one, do they need to submit manually with start and finish times when using nitrous oxide?
No, it's different than the ministry program in that regard. We just need to know the units of time.
Will the criteria for crowns be the same as previous NIHB plan, or are there new criteria in place? You might have already touched on that, but.
Yeah, the criteria will be our PBC standard. So check the fee schedule regarding the criteria and documentation required for crowns, and that will be the criteria going forward.
Yeah. For the endos, can we do more than 2 consecutive teeth in a year? Like tooth number 16, 17, 46, and 47 all done in 1 year?
Yes.
Yeah.
Yeah, it's the standard Pacific Blue Cross fee schedule 3 rules. That's once per tooth per lifetime.
There are a couple of people asking about the FNHA fee supplement and where it's available. I did send out a message with the link for that a little bit earlier, but I can do so again in just a moment. Just ask that. As for insurance setup in our system, policy is 40,000. ID is status number. What should be entered as the employee?
We don't check that information. I think that's, so in the middle section of the claim form, it's usually the card holder that goes in there.
Okay.
Yeah. And then the bottom part, I think it's part 3 of the claim form, it's where the patient information goes. So in the First Nations Health Authority case, in the vast majority of cases, the clients will be both the member and the patient, except for those infants who are under 18 months who are covered under the mother's status number, and that's where the patient info will be different than the certificate info.
As long as the policy 40,000 is there with the status number, that's fine. Yeah, then they can just basically, you can just ignore the employer field for that coverage.
Okay. So I think we have 2 people online who have raised their hands. So I think we're gonna give them the ability to speak. First, I have the Lakewood receptionists. I'm gonna give them the ability to speak. Unmute you.
I don't know how that works.
Okay, go ahead and ask your question. We can hear you.
Can you hear me?
Yes.
Okay. We want to know when the software companies will have the provider fees to download. It's not me she's hearing, is it?
Well, it's based on the Pacific Blue Cross fee schedule, so they already have it if they can point the First Nations Health Authority plan to the Pacific Blue Cross fee schedule 3.
Oh, okay.
Then the vast majority of it is there already.
Okay, that's good. And our second question was if they have PVC and then NIHB, will those be coordinated automatically?
Yeah, it's kind of like the 2 Pacific Blue Cross plan scenario for us, that if we know they're one and the same person in our system, there's times where we don't, but where we can make an exact match between the Pacific Blue Cross coverage and the First Nations Health Authority coverage person, then they'll be linked together and coverage should automatically adjudicate.
Perfect, thank you.
You're welcome. Sorry, I'll just add to that, and if you do find a case where it's not auto-adjudicating, please call our call center, let them know, and then we can make that direct identification and be able to merge the coverages, and so that the next submission will be auto-adjudicated.
Perfect.
Great. Thank you. All right. Our other person put their hand down, so I don't think they need to ask a question anymore. Someone asking. Okay. Is EDI pre-authorization allowed for basic services or only through ProviderNet and phone?
You can submit pre-authorizations, predeterminations for basic services under EDI as well. Again, it's just a great way to know what is covered, how much is eligible, if they've already used a certain amount of limit. Yeah, so we, yes, it will work, and we are more than happy to receive those and provide the information accordingly.
Let's see. Will PBC cover Valplast partials?
Sorry, again, I don't know the fee code off the top of my head, but the vast majority of partial dentures will either be covered in full or paid at an alternate rate. So if you look the fee code up, if it's not in the Pacific Blue Cross fee schedule, look it up in the fee supplement, and then it will tell you whether it's covered in full in the fee supplement or if it's paid at a basic rate of another code that's already in the Pacific Blue Cross fee schedule.
Okay. Someone asking, I think just for a little clarification, do we start submitting pre-authorizations tomorrow or not until the 16th to PBC?
Not until the 16th.
That's what I thought. Can you do zirconia crowns now, or does it still need to be only PMFs? PFMs.
Again, it's all the codes that are in the Pacific Blue Cross fee schedule for crowns are covered. So there's no limitations there. I think there's a couple of fee codes that you'll find in the fee supplement that show that they're paid at the basic rate of a code that's in the guide. In the PBC fee schedule, sorry. Two documents.
All right, so there is someone asking about some specific codes. They're asking about code 27301, 27201, and 27211. That they're not listed in the fee supplement. These are FGC, PJC, and PFMs.
Yeah, they're in the Pacific Blue Cross fee schedule, so they're covered as per normal.
Okay, they're just not in the fee supplement because it's not
Yeah,
different.
It's not different.
that's right.
Okay. Someone asking, when you call PBC, do you call into the PBC plan line, or will there be a dedicated line like the ministry patients, like one specifically for ministry patients?
I believe the phone number that we're providing is, one second, let me just have a quick look.
So for providers, I think you call our regular provider line, and then you'll be directed to choose the First Nations Health Authority coverage.
That's right.
Wonderful. Well, that's all of the questions that we have at this time. So we made it through. Yeah. All right.
So here's the contact information for FNHA, PDC, or the BCDA. If you have any questions after this, like we mentioned, we'll be posting the webinar and the slides so that you can access all of this information. We've told you numerous times today to check out the PBC website for the provider reference guides and the fee schedules. And of course, email us if you have questions.
All right. Thank you very much, everybody.